My name is Jane Barrett, Secretary General of the International Federation on Ageing. On behalf of the IFA, welcome to the fourth webinar of the Post Global Conference Education Series. The IFA is an NGO in formal relations with the United Nations and the World Health Organization. We're headquartered in Toronto, Canada, and we aim to be a global point of connection of experts and expertise to help influence and shape policies that impact the lives of older people. Today's webinar, What is the Role for Public Policy and Technology in Increasing Immunisation Uptake Across the Life Course, is the fourth webinar in our series. With a growing population of older people across the globe, it is now more than ever critical to determine ways to maintain and improve the functional ability of this cohort, as well as ensure these issues are addressed in both policy and practice. It's my great pleasure to introduce colleagues from the ILC UK, Mr. David Sinclair and Miss Lily Parsi. David and I go back many, many years. We're good friends and colleagues and partners in crime when it comes to trying to understand the role of NGOs in improving the uptake rates of adult vaccination. He's the director of the International Longevity Centre UK, worked in policy and research on ageing and demographic change for some 15 years, has worked extensively on the issue of adult vaccination over the past 8 years, and was a leading member of the SATI Coalition, board member of the Coalition for Life Course Immunisation. David has spoken many times around longevity and demographic change across the world, from Stafford to Seoul to Singapore to Stormont, and also in Toronto just last year. In 2016, David won the Pensions Network Award for the most informative speaker, 2006 and 2016. You know, he's innovative, dynamic, and is frequently quoted on ageing issues. Moving to Lily Parsi, Lily coordinates the ILC's policy and external engagement work across all policy areas. She currently is leading on the global program on the future of infectious diseases, which examines the state of infectious diseases 100 years on from the Spanish flu and addresses the role of policymakers and the general public in preventing future infectious disease outbreak. She is coordinating an international program of work exploring the importance of prevention in our ageing world. And Lily sits on the advisory board of the Age Action Alliance and was previously the Secretary of the European Nutrition for Health Alliance. Before I hand over the platform to David and Lily, just a note, attendees are welcome to submit typed questions through the platform in the Q&A section. And after both presenters are finished speaking, we'll take as many questions as possible. I'd like to also just acknowledge the phenomenal work of Hannah Girdler, IFA Project Officer, who sadly is going to leave her full-time position today at IFA, but we're not going to let her go. So thanks, Hannah, for all of your work. And it's now my pleasure to hand it over to Lily. Thank you very much.
Sorry, for some reason our slides aren't moving, Jane, just after.
Okay.
Is that working? There we are. Okay.
Yep. Good.
Great. Sorry about that. So I'm David Sinclair from the International Longevity Centre, and the first thing to say is really thank you, Jane and IFA, for this opportunity. We work extensively together with IFA and certainly have very sort of common interests and common passion of tackling some of these what seem to be really obvious challenges and where policymakers really need to act. So ILC UK is one of 16 ILCs, and we really in the UK describe ourselves as a specialist think tank on the impact of longevity on society, but work globally with our colleagues across the other 15 ILCs. I'm going to pass over to Lily. The way we're going to split this up is Lily's going to talk about some of the work we've been doing on infectious diseases and the Spanish flu, and then I'm going to talk about a new report we've launched today, which attempts to address some of the issues that have emerged through the Spanish flu work. So,
okay, great, thanks. So as David mentioned, we've been doing some work on the Spanish flu, which is really a kind of case study to see where we are with infectious diseases today. And across this program of work, we had a number of events that we organised in London, Boston and Toronto, looking at what public policy, industry and the public can kind of do to respond to the challenge of infectious diseases. So to give you a kind of quick overview of what the Spanish flu was, I'm sure many of you will be aware. So it was a very big influenza pandemic that killed between 50 and 100 million people and infected around 500 million. So actually within 24 weeks, killed more people than AIDS did in 24 years. And between 1914 and 1918, claimed more lives than World War I or the Black Death. And so over the last 100 years, we have seen a great reduction in deaths from infectious diseases. So from 800 deaths per 100,000 people in 1900, we're now down to 46 deaths per 100,000 people in 2014. Illustrated here again as well, we've seen a huge reduction across males and females. And as a result of this, we've really seen, a huge boost in people that make it to 65 and over, and it's massively contributed to extending life expectancies across the world. So overall deaths from infectious diseases have fallen. There's a multitude of reasons for this. Firstly, we've seen great improvements in clean water and improved hygiene. We've seen reductions in absolute poverty levels across the world, which are greatly linked to incidences of infectious disease outbreak. We've seen across the scale investment in preventative health. And in particular, we've seen the introduction of vaccines that have helped us to essentially almost halve deaths from vaccine preventable diseases in the US in this case, but also across the world. However, although deaths from infectious diseases have reduced, there's no cause for complacency, and actually infectious diseases today are still far from defeated. Over the last 60 to 70 years, we've seen 3 major flu pandemics come up again. Moreover, from 1980 to 1994, there was actually an increase in death rates due to infectious diseases. And this can especially be attributed to the rise in HIV. We've also seen a rise in infections transmitted by insects, so vector-borne diseases. And pneumonia and the flu still remain to be the biggest infectious disease killers in the US, currently accounting for about 40% of deaths from infectious diseases. And especially in this, not to be forgotten, low-income countries are disproportionately affected. And in 2010, infections still caused the majority of deaths in low-income countries. This is partly because an estimated 2.4 billion people still lack access to improved sanitation and clean water. So the burden of infectious diseases that many seem to think has moved on actually remains, especially with pneumonia, HIV, TB, and malaria. So looking at where we are now with infectious diseases, we kind of want to look a little bit towards the future and see what some of the emerging risk factors are of our modern society. So one first point is that, especially across the developed world, we seem to have an increasing feeling that infectious diseases, either don't affect us or medicine can cure them all. Whereas actually that's not at all the case. And as a result of this growing complacency around infectious diseases, we've seen that while countries like the UK still have very high vaccination uptake, actually across Europe, just over 1/3 of older people are vaccinated against the flu, which means that the majority are still at risk in case of an outbreak. With this, we've also had a surge of fake news that's undermining consensus science. And this growing anti-vaccination sentiment has meant that previously thought to have been, completely eradicated diseases such as measles have actually returned in many European countries. And fake news isn't new at all. So the term Spanish flu itself is actually a result of this, where although it was affecting people across Europe during the First World War, in order to kind of keep up morale within the trenches, many countries sort of underestimated how much it was affecting people, and essentially framed it as a merely Spanish phenomenon. We also see a growing risk of antimicrobial resistance, which could fundamentally reduce our ability to recover from disease. And this is especially a growing risk because actually the development of new and better antibiotics and antivirals is not easy or quick. So there's a very complex production process which has a complex range of stakeholders. So this is something that needs to urgently be addressed. Trends of austerity across Europe have resulted in reduced investment in preventative health, many of the effects of which we are sure to kind of see in a few years to come. Between 2009 and 2014, public spending on prevention fell by 2%, whereas actually inflation would have meant it should rise. We've also seen trends such as climate change, which threaten to increase the likelihood of infectious diseases, as well as urbanization. So with about 70% of people predicted to inhabit towns and cities by 2050, urbanizations could create very favorable conditions for infectious diseases to spread quickly and easily between dense populations. There are also kind of counter arguments to this, that living in a city with good urban infrastructures could help combat poverty and inequality that are associated with infectious diseases. Moreover, it creates better infrastructure for people to access improved hygiene, sanitation, as well as access to good healthcare. And the final trend we've been seeing is, of course, migration. So both in terms of travel as well as kind of permanent living, which has contributed massively to the heightened risk that a disease can spread rapidly across different countries and societies. And as Professor Dame Sally Davies very, very rightly pointed out, it's now possible for a person to travel around the globe in much less time than it takes for symptoms to appear. So there are huge challenges to policymakers across the world to really tackle what might happen in the case of another future infectious disease outbreak. And what we really need is a much more coordinated response across government, as well as individuals and industry, to work together for this. And as Bill Gates puts it, we need to prepare for pandemics the way the military prepares for war. And this, the great lack we've seen of really tackling this issue and taking it at face value when a lot of people alive today haven't really seen the consequences of infectious diseases is a huge challenge. And I'm going to pass over to David now to look quickly at the report that we've launched today, which explores how we can use technology to overcome some of these barriers.
Great. Thank you very much, Lily. Yeah, the reason we wanted to tie these two presentations together is I think what Lily has highlighted is that the risks of infectious diseases, whilst we've made massive progress over the last century in terms of infectious diseases, there is a real worry that some of those trends that are happening might pose additional risks in the future. So infectious diseases are far from wiped out, but actually there is a degree of complacency about them. And what we really wanted to do with the report we're launching today is explore the extent to which sort of innovation and technology can really try and play a role in solving some of the challenges we have across the world in terms of increasing vaccine uptake levels. I'm going to run really, really quickly through the slides. The full report is on the website. Also, we're not going to cover everything in the report, clearly. So, for example, in the report, we talk a bit about things like material science, and I'm not going to go into detail about that simply because of the time today. I'll see what we've really been trying to do here. I suppose what I'm going to argue is that technology can help improve the uptake of adult vaccination. I think what we've done does show that. There's actually loads and loads of ideas about different things that could be done. But actually there's also some really interesting then policy messages and actually a need for action, I suppose, is if we're going to realize the potential of technology in this space. So the background of this is back last year, in 2018, we wrote a think piece that looked at things like everything from blockchain to gamification, and looked at, you know, the extent to which some of these innovations could play, you know, what were they, and how might you know, there'd be a link with adult vaccination. What we then did is we went to Brussels, and we had 70 or 80 people in a room, and we got a group of people to talk about starting point being the barriers to uptake across Europe, but then really looking at, you know, in the context of whether we're blockchain or games or apps or the internet, what can technology, what could feasibly technology do, and why is technology not doing it? So what are the barriers here? And then we asked the participants to look at what policymakers really need to do in terms of ensuring we do maximize the potential of some of that new technology. So I'm going to run through these bits very quickly. Clearly, we know one of the reasons we've done this piece of work is we know adult immunisation is extremely important still, despite the falls in infectious diseases over the last century. We're still seeing 40,000 at least deaths per year in Europe as a result of influenza. Direct deaths, I should say, because there's likely to be indirect as well. I know IFA have just published some interesting research in this space as well, on the sort of the knock-on effects of flu. We know that pneumococcal disease is a huge killer, both in the community but also in care homes, and we also know that herpes zoster is a very significant has a very significant impact on the older population. So it's really, really important in terms of the health of the older population. And as sort of, you know, I suppose what's very clear though is that across Europe you have very, very different levels of uptake. So places like Estonia, Latvia, Poland, very, very low proportions of older people have had the flu vaccine. It's only really the UK and Netherlands that get anywhere near close to the EU target of 75% of uptake around flu. So most of Europe is failing in what they're committed to do in terms of uptake. On the one hand, we've got low uptake. On the other hand, you know, we are seeing this revolution in technology. So there's an image on the right of your screen here. You know, it's not that long ago, 20 years ago, where we had 15 devices that did essentially what a mobile phone does now. The world is changing so rapidly, and the potential to change the way we live our lives is like nothing ever before. So on the one hand, you've got this massive innovation in technology, but on the other hand, I use this quote from Rory Cellan-Jones. Actually, in some places, you know, it's proving more difficult to change. So that he uses the quote of Concorde that, you know, it used to actually be quicker to get to New York than it is now. You know, it's actually very difficult in places like Europe to build train lines. You know, there are certain aspects of technology where actually things are slowing down, and it's proving more difficult to get change rather than quicker. But undoubtedly, technology is changing our lives. In the European Union, we've seen a lot of interest in this area, mainly around children, but not exclusively. The president used his State of the Union address to address some of the real concerns we've got at the moment in Europe around coverage levels of vaccination. We've had a number of commitments from the European Commission, including the €5.8 million investment in the Joint Action on Vaccination. And we've also got, in terms of the work that is going on health, the development of policy ideas around the potential for a common vaccination, electronic common vaccination card that could be developed, shared across borders, European information portals, and tools to counter online misinformation. So European policymakers are interested as well. So we've got this context of relatively low uptake figures, technology that will change the world, and European policymakers who are absolutely interested in this space. The WHO equally see both technology and indeed health and indeed vaccination as being really, really important aspects of improving the health of other people. So let me run through some of these sort of case studies relatively quickly. The first area we looked at in terms of the report was how we can use data better to increase uptake of adult vaccination. And this is a chart that has come from the UK. So it's 2013, 2014, but the UK is a really good example of probably a world leader in this space, where they have a very, very strong immunisation information system where basically every week central government has access to uptake figures over the period of winter, say between week 35 and then the spring. What government can do is, what Central Department of Health can do, is delve down into individual GP practices to identify areas where you've got very low uptake. They can pick up the phone and say, why haven't you vaccinated anyone this week? So real strong use of data to actually to influence the program and then force and support increased uptake at a very local level. Data is also potentially useful in terms of monitoring the spread of diseases, and there are some really interesting disease surveillance systems, including some that are actually used where users themselves sort of crowdsource, where governments collect crowdsourced information to actually identify the spread of communicable diseases. Data can also play a really, really important part in identifying the key population who might benefit from vaccination, and we're seeing growing use of data in this space to really just identify who it might be who could most benefit from vaccination. In the workshop we had lots of different ideas around data, including the ideas for information campaigns tailored at personal data, the development of online risk calculators that could help people understand their risk of infectious diseases, and actually, really like the idea of having a mobile technology that links in with your location data that could basically remind us when we're in the UK, for example, when you're walking past a pharmacy, that it's the time of year you should think about having the flu vaccine, and a prompt comes up, and maybe even a discount or something. So really interesting ideas in this space. Second area we looked at was the internet. Of course, the internet's got a really bad reputation in this space. There is real concerns from policymakers that quite rightly that the internet is allowing for the sort of development of fake news, as Lily said before. It's allowing groups of people who are very skeptical to have a voice which they wouldn't otherwise had. I think in this space, the internet does, however, offer massive opportunities. So, for example, we are seeing there is potential for using the internet to identify and intercept negative trends, and there's some interesting people doing this and responding swiftly. I think what's became very clear from the work we did in this space, that there's lots of potential for online engagement, and a lot of discussion at our event, our Futures workshop, was really around how vaccine advocates need to be present and active online, really leading the argument. And actually in this space, we have seen massive changes. So, the story is often very negative in this space, that, you have a big online anti-vaccination community. But actually, since 2013, you've seen a big growth in, whether it be on YouTube, whether it be on other online sites. You've got Dr. Mihai in Romania, Dr. Burioni in Milan, who've got, these people who are putting science-based posts up which get sometimes 1 million to 4 million people. So you're seeing them. So you are starting to see, the science community responding online. You have, Reddit has a lot of sort of vaccination material. And actually, a lot of it is, and I'm not sure, we could debate later about, the extent to which, ridicule is the right sort of approach here. But actually, Reddit is definitely a real challenge to sort of some of the anti-vaccination movement. So you are seeing some really interesting online movements developing with different sorts of styles. Who are responding to some of the challenges of fake news. Very clear from the work we did that if we are to improve the online engagement, really important to walk in the shoes of the patient, to really invest in new ways of communicating, including online, and actually, as I said before, actually joining some of those conversations. In this space as well, we had lots of ideas, including things like we should be using Instagram influencers in this space. And interestingly, I was talking to someone yesterday about this, and they said that there actually are some out there who are already doing this, talking about vaccination. So really, really important. So we are, I think, seeing some really interesting developments in this space. The next area we looked at was Internet of Things. So this is all the smart watches. I'm one of these geeks who does wear a smart watch measuring my steps and things like that. There is predicted by 2022, 10% of the world's population will be wearing these. And we're already starting to see some innovations in this space. So you have in India a necklace which records vaccination history, for example. So there are some innovations in this space already happening. Again, when we talked about ideas with our futures workshop here, people talked about things like people went to the extreme now. Someone recommended a barcode on our skin. I suspect that's not something that we'd convince many people to go for. But actually, without a doubt, the use of, people talk about the idea of a virtual lifelong personal assistant who could give us advice on health behavior and remind us about the need for screenings or vaccination. I think there are some really interesting things going on in terms of the Google Home, Alexa, Siri in this space, where they're actually already being tested to actually, whether the extent to which they can actually book vaccination, or indeed other appointments for you. So there's some really interesting things going on in terms of the Internet of Things. We also looked a bit at games and the role of games in this space, and games is one of those areas where there is still mixed evidence around efficacy. So do they really work? There is, however, some emerging evidence that games can play a difference. So there was a randomized controlled trial in Italy that incorporated gamification in terms of their knowledge around MMR and vaccination. So there is a bit of evidence, but I think in this space, we definitely need a bit more evidence around what and how it works. There are some brilliant games out here. Plague Inc., which is online, but there's also a board version, is a game that CDC themselves in the US has highlighted using a non-traditional route to raise public awareness on epidemiology and the potential for pandemic. So you are seeing some really interesting and indeed good games out there that can engage people with some of the issues and challenges. Again, we had some really interesting ideas, people talking about, wouldn't it be fun to have a VR headset game where you saw a doctor saving the world, or immersive virtual reality where people could realize the impact of serious diseases. So I think people sort of, there's a real sort of interest in how can we engage people through games. Almost coming to the end, one of the other areas which is clearly a big developing area in terms of sort of technology is the growth of the sharing economy. And really what we mean by that is the growth of sort of different models of selling and engaging with products and services, whether it be your eBays or your Ubers or your Airbnbs. And again, you're starting to see some interesting innovations in this space already. So Uber, for example, teamed up over in the US to explore whether or not they could have a nurse in a car, and you would call your Uber and the nurse would come around to your house and give you a vaccination. They're really, really interesting sort of examples of innovation in this space where, for someone who can't, for example, get out to easily to get a vaccination, where maybe we can use some of this technology to improve transport and access to where someone might be vaccinated. We looked a bit in the work we did around the role for AI in robots, and without a doubt, in some countries there, that there's a really big potential in this space. In some places there's no system to identify at-risk individuals, and yet could AI actually help identify at-risk groups? And again, IFA led the world really in some of the work they've been doing around at-risk groups and vaccination. So could some of this new interesting technology help identify some of those people who are at risk? You're starting to see some really interesting stuff in this area. So there was a story in the Financial Times last October, or the one before, talking about how AI was being used to identify and develop new vaccinations, new drugs, but also in terms of robots, we're starting to see actually the delivery of vaccination through drones, for example. So there is really a potential role in this space. Again, some of the ideas that came from our workshop, we talked about bots that can have conversations with people about their concerns, or the idea of some sort of robot carer who could remind where vaccinations are due. So there are some really interesting ideas out there. There has been some pilots around the use of sort of humanoid style robots to actually distract children from the pain or the fear of the needle. So actually there have been some trials in this space, and clearly potential for some really interesting, innovative uses of robots to actually just get vaccines out across different countries across the world. So what were the messages? What are the big messages from the work we've done? Well, I think first thing to say, and these are, I suppose, messages dash lessons. I think it's very clear to us that technology could improve vaccine uptake, but actually that we really need to start from the point of view of the patient. And clearly some of the ideas I've talked about are a little bit crazy. Some actually might work. But actually for older people who may still not be online, for example, so there are some older people in different countries, who are digitally excluded. Actually, offering an app for someone who hasn't got a mobile phone is going to be a bit of a waste of time. So we've got to make sure we tackle digital exclusion if older people are to benefit from the technological sort of revolution we're going to be seeing. I think secondly, it's really, really clear that, from the experience in the UK, that big data is already being used to both monitor diseases, review vaccination coverage, identify target populations. And actually, if we could do more of that, if governments could do more of that, it strikes me that there are some easy wins in that space. We think that it's really important, though, that we do have greater consistency of data collection and shared platforms. So actually there is a real challenge to maximize the potential of data if this data isn't available for governments to really help their aims of increasing uptake. And but at the same time, one of the things that came through very clearly from the attendees at our event was a real concern around issues around privacy and choice, and how do we make sure that individuals who are concerned about the use of technology do have their concerns listened to and are engaged with. So how, but equally, how do we make sure that in a world where we're using more and more data, that the individual data is being protected and that there is no risk of abuse. I think I was trying to posit a sort of a slightly more positive message than you sometimes hear in the media around fake news, and actually I think the pro-science community is catching up. And I think that the next steps is this, moving from just having content to how do we create this sort of imaginative response that really engages people emotionally in terms of the arguments, because of course that's what the anti-vaccination community manages to do very, very well. In terms of other thoughts, it's very, very clear that to me that we do need governments to continue to support things like the WHO Vaccine Safety Network and accreditation, so people know what websites and what information to trust. I suppose that it's worth saying, sort of final sort of thought in terms of lessons before I move into policy is, of all the ideas we've had, actually it's not clear what will really, I think what will really make a difference. And I think technology is often seen as this sort of magic bullet or this solution which will solve the problem of aging or solve the problem of in this case of vaccination. I suspect that some of the things I've talked about will be a complete distraction and maybe unhelpful. I think the challenge is, and what we're going to have to do over the next couple of years, is really get into piloting some of these, finding out if they really, really work, and then investing in the ones that work, and dumping the ones which actually, where there isn't any effectiveness and where they are just a distraction from the change we need to see. In terms of sort of the public policy recommendations, we've taken 3 real areas which we thought public, and particularly European in this case, should focus on. I think we'd be interested in hearing from people whether or not these messages were relevant across the world or just for Europe or for or in specific countries. So the 3 things we've argued is that there is this need for a policy framework to support innovation, regulation to support innovation, and the need to take a life course approach to vaccination. So, and let me just pick a couple of specific ones. In terms of a policy framework to support innovation, we think there's a need for a very specific funding program on what works, so we can ensure that we really know what works before investing significant financial and indeed sort of policy brains into ideas which might not. So we've got to make sure we know what works, and I hope we'll see more pilots and tests out in this space. Actually, I'll touch on the bit at the end. I think we also think what a really important thing in this space is actually we've got to make sure that innovation does focus on those most in need, whether that be at-risk groups, at-risk older people, because actually if it doesn't, you run a risk that only people who are digitally included or engaged with technology will benefit, and that you end up with greater exclusion rather than inclusion as a result of technology. I think it's really important that policymakers protect against that. We need the right sort of regulatory approach to support innovation, and again, IFA have done lots in this space, as have people like the Age Platform. Really important that we have legislation to ensure any sort of technology products and services are as accessible and usable as possible for all ages. So we've got to make sure we have the legislation around age friendliness to make sure that people can use some of these technologies if they're to benefit from them. And then in terms of the life course approach, we think it's really important that policymakers do recognise the challenges of demographic change and ageing, and work to support vaccination across our whole lives. I think that we should, at a European level, have a EU-wide programme of events to encourage uptake in adults, as well as the focus we currently have on children. So that's where we were arguing in terms of recommendations, and again, be really interested in people's thoughts in this space. Again, my come back to where I started. We think technology could help in terms of improving the uptake of adult vaccination. As you've seen, there was no shortage of ideas. Some good, some a little bit crazy, some interesting, some novel, and do have a look at the report for some more in that space. But actually, we do run a risk that unless policymakers, the industry advocates, and indeed innovators work together, we just won't maximise the potential that technology offers. So at that point, I'm going to stop and pass back to Jane. Right?
Look, and thank you very much, David. Can you and Lily hear me?
Yes. Yep. Great.
Good. All right. Look, and thank you for a very informative presentation. I also just want to repeat the name of this report, because I think it's an important report that takes us to a different place of understanding about improving uptake rates, and that is data, bots and drones. Can technology help increase uptake of adult immunisation? And I know that there's been some press releases about it. It's up on your website, and it will be up on ours too. We do have time for some questions, so I'm just going to move on to it. So the first question is really about based on your work, are the barriers to promote vaccination, and let me put in brackets adult vaccination, similar across regions, or are there key differences across different populations? So are they, in summary, are they different or the same across regions? And are there key differences, across different populations?
That's really interesting question. I think my sense from what we've done over the years, and indeed another piece of work that James kindly agreed to speak at the launch of it, in Geneva alongside the WHO, I think a key message is that actually a lot of the issues in terms of barriers are similar across the world. Where things vary is in terms of things like access. So, for example, physical access to vaccination varies in places where, so in the places like the UK, we have widespread now direct vaccination through pharmacy. Similarly, in places like Ireland, the US uses pharmacy. Of course, in most of the rest of the world, you don't. So actually, if you're an older person in the UK and want to have your flu vaccine, you can just pop to your local chemist on a Saturday afternoon and have. So access will be different by places, but actually, and what governments do is different, and clearly, government recommendations are different. And I think it's also worth saying that different governments have different willingness to promote vaccination. So some have actually pretty comprehensive adult vaccination schedules, but don't really tell anyone about it and don't really focus on uptake. Others have very, very weak schedules. So I suppose my take is that the policy environment is very different. But if you talk to older people, which we've done for this other project we're launching in Geneva, actually the main barriers are pretty similar across the world. So sort of, and I suppose that should be comforting for policymakers. I guess the real worry and the real outrage in this space is that places like even the UK doesn't achieve its 75% up. It is an outrage that we have developed countries in Europe who have pretty atrocious levels of uptake figures, and I think government should really be embarrassed about the fact that we have actually, if places like the UK and others can do it, then so can many others. So my sense is that we shouldn't be looking to blame or look at the barriers facing older people, more look at how governments can really push this agenda, and they do have a responsibility to do so.
Look, David, talking about outrage, I'm always outraged when we talk about choice and how ageism and age discrimination is a fundamental barrier. Could you just, the question is, what are some of the possible reasons for the inconsistent narrative among healthcare professionals? Because we know HCPs are really the gateway to the decisions that people make around their health. So could you just comment on, do you have any understanding, or what are your thoughts about, you know, this inconsistent narrative and the whole issue of ageism?
Yeah. I think it's a really important point. I think it's worth saying that actually, in terms of healthcare professionals, there aren't many places across the world that's really got this right yet. And you know, one of the findings of another piece of work we've been involved in recently is, you know, that the argument that it was made by older people that if healthcare professionals themselves aren't being vaccinated, then why should I, as an older person? Yeah, so a sense of, you know, why would I do it if others aren't? So I think there is a really important role in terms of healthcare professionals. My sense is that you know, maybe there is a bit of ageism in this space. You know, that actually, you know, that, you know, so one of the interesting things, if you look at hospitals in the UK with very, very high rates of uptake of flu vaccine amongst staff, and there's a couple of things that drive it. One is brilliant leadership by staff, and I think it's really important that we support the leadership of healthcare professionals, and there are some brilliant ones doing some great stuff. And the other is that they're in children's hospitals. So I think you do have a sense in some children's hospitals that, you know, actually vaccination is really, really important because we mustn't have these diseases spread. And I do slightly worry that there is a bit of complacency in some general needs hospitals. There is it's certainly a perception that, for example, influenza is not a serious disease, but actually we know in itself it is, but also that it can have very serious repercussions in terms of, you know, the likelihood of people having other communicable or non-communicable diseases immediately afterwards. So my sense is there probably is some ageism out there, but actually maybe that's something where there's a need for a bit more work to really understand that. Without a doubt, you know, clearly you don't have the same interest in vaccination. You know, one of the messages I think, Jane, both you and I have talked about for a lot is, you know, vaccination isn't just for kids, and yet, you know, a lot of the time that's what the message that's coming out. And I think clearly vaccinating children extremely important, but we've got to make sure that actually with new, smart, clever, good vaccinations for adults, we're getting those out too.
Oh, I'm so sorry.
Oh.
I've been on mute. So
I'm
I
sorry.
I will have to start
It
again.
went very quiet. Sorry about that, Jen. Sorry.
No, it's me.
Yeah.
So question from Lois.
Yeah.
As you mentioned, there is evidence that use of data via registries correlates with increased vaccine uptake. Given the fragmentation of providers in the adult vaccine space, what can be done to get the reach or use of technology that would be needed to make the data actionable and representative of what is happening across the country?
Mm-hmm.
So we've got another couple of questions, so I'll hand that back to you, David.
Great, thanks, Jen. Yeah, I think, you know, as I say, you know, one of the data for me is where there is the most potential and the most sort of interest, whether it be using Google, using other sorts of data in this space. So really, really exciting opportunities, but we need to make sure whether it be private data or government data, it is actually used and is accessible in terms of making the most of the potential. And I think that the challenge there is for governments to make sure that as they contract with industry and others, that we do have the right sort of environments to that we are making sure that that people do have access to the data, so we can make the most of it. It's worth saying. So one of the examples we had in the report was, of course, all vaccines are barcoded. Actually, a really interesting way of monitoring uptake is just, I say simply, shouldn't be too simply, shouldn't be simply, it should be simple, is linking, scanning the barcode when someone is vaccinating it and linking it to the health record, and actually then using that to identify who has and who hasn't been, benefited from their vaccination, and things like that. You could start to see being done more and more if we can get data permissions done right.
Okay, thanks for that, David. And from a colleague in the in your region, Alan, is there any possibility of requiring a vaccination card or smartphone app for entry into countries in both the UK and EU?
I would say, one of the challenges that Lily touched on earlier was, or issues is of course migration, and the fact you are likely to see a greater spread of disease around as we all move around the world more and quicker. European, actually interesting. So, my sense is that the European Union is interested in doing something. I suspect it would never be a requirement of coming into Europe, although I know that there are certain vaccinations that and certain countries where there are requirements. I think what's key actually is making sure that we do have a system of when people come into Europe, whether particularly if they're moving as a permanent residence, that we have a system of updating and ensuring people are vaccinated. There was a lot of work that happened in places like in Greece and Austria, for example, when we saw big migration a couple of summers ago, where we were making sure particularly children were being vaccinated as they come in. But I think so I suppose my sense is that, the big issue around vaccination card actually is not around requiring it. It's more about how can we use that sort of technology to help us remember. So, I don't remember, for example, when I last had my my tetanus diphtheria, my tetanus update. If I don't know someone who's a geek in this area, how can we expect anyone else to? So if we had vaccination cards or apps that would remind us about this, that linked into our healthcare records, then I could see that being as helpful.
Okay, look, thank you for that. Look, we have one last question. So it's a bit of a two-prong. So first of all, are there any resources available that discuss best practice in countering false information? And the second, are you aware of any municipal or national governments that have taken on these technologies as a way to promote vaccination?
So I think in terms of the first question and the resources, I think there are, the WHO has got some really interesting work out there and is supporting some interesting work, including the work on the work around and it's partly led by their fears around the world of fake news. There are there are also, so the WHO have some, and there are also some initiatives like things like Vaccines Today, which are all about countering some of those false messages. I think maybe I should go away and look at what resources there are in terms of countering. I think one thing that's worth saying is that in different countries there are likely to be different responses, and that individuals are likely to respond very differently to different sorts of messages, and we can use technology to target that messaging. So for example, it's worth saying that so for example in the UK our policymakers have decided that the best way to respond to the sort of anti-vaccination movement is to completely ignore them, and that actually as a result of that they wouldn't go on panels with them, they don't listen. They've decided that actually the minute you do that, you give someone a voice and suggest that they have 50% of the evidence. In other countries you've seen opposite sort of approaches where you have seen sort of movements. But I think the key thing is for us to actually start to use personalized data to really understand what would motivate me versus you, whether it's me as a father or grandfather, or whether it's me as someone who works in London, or me, or, we're getting pretty smart at understanding how to target that messaging.
Look, thank you very much for that. It's been a really busy session, and I just want to thank both David and Lily on behalf of all those that registered and have been part of this webinar. You've really taken us into a bit of a deep dive into public policy and technology in increasing immunisation uptake rates across the life course, so thank you. For the information of the attendees and all those that registered, this webinar has been recorded and will be uploaded to the IFA website and emailed out to attendees. And perhaps we can even coerce ILC UK to put it up on their website soon.
Definitely.
We also welcome everyone on this call to the IFA's global conference entitled Rights Matter, and to focus the attention on this whole area of adult vaccination. The IFA, in partnership with ILC UK, of which we're very proud of, will be having a one-day event prior to the global conference. So that will be on the 30th of October. So there's a slide up there that gives you some information, but we welcome your ideas and your participation. But most importantly, thanks to ILC UK for your partnership, for your work in the area, and for the presentations today. Thank you very much, David and Lily. All the best.
Great, thanks. Bye. Bye.